Well, do you experience back or neck pain? According to our next guest, there may be a common reason why. So here to share more about degenerative disc disease is Dr. Bimal Rami. Welcome.
Thank you.
So tell everybody, what is degenerative disc disease?
Well, actually, I think degenerative disc disease is a little bit of a misnomer. Degeneration of the disc is a natural evolutionary process. As you age, those healthy young discs, overgo wear and tear, and they can become degenerated and smaller and cause pain.
Okay, so everybody's saying my neck, my back, as I get older, it really is a thing.
Yeah, a fraction of people, it becomes more of a problem for them, where they get disabling back pain or neck pain, arm pain or leg pain.
Okay, and so let's talk about the symptoms. Is it just pain?
Yeah, most of the time can be pain, but also numbness, tingling, and in extreme cases, weakness.
Oh, wow. All right. So let's say that we come to you and we have some of these symptoms. Then how do you diagnose that that is actually what it is?
The gold standard test is what's called an MRI of the back or neck, magnetic resonance imaging.
Okay. And so if our back or neck pain is caused by this degenerative disc disease, right, but it doesn't respond to medication, what else can we do?
Yeah, I think that's when you would have to come to a person like myself, a surgeon, who can give you some ideas on interventions that can be made to decompress those nerves.
Okay, so are there any kind of injections that people can do maybe before surgery?
Absolutely, yeah. There's a whole host of injections that can be delivered to the back and neck.
All right, so can you talk to us about some of those minimally invasive procedures that you can do?
Yeah, I mean, there are lots of procedures that we can do that involve just a small procedure that can decompress that nerve that's being pinched either by a bone spur or a disc herniation.
Okay, so let me rewind a little bit.
Okay.
So can we talk about maybe some of the differences between just regular neck, back pain, maybe I slept wrong or I pulled something, and actual degenerative disc disease?
Okay. Yeah, I mean, regular neck and back pain is something that everybody can experience, and usually from some sort of manual labor or repetitive motion. And that can be addressed through very simple over-the-counter medications like or physical therapy. But then in extreme situations, that's when you need to see somebody else to take it to the next level.
Okay, and so when do we know that we should actually, I mean, is there like, I've taken meds for 2 weeks and this is bothering me, or is it kind of a chronic thing? How do we know when it's time to see you?
Yeah, I mean, I think that most people who, if the neck or back pain lasts more than 6 weeks, and it's becoming more of a persistent and progressive problem, then you might need to seek some extra help.
All right, so talk to us about the medical advancements that you're making now, right, that can reduce the risk and significantly decrease that recovery time.
Sure, yeah. I mean, the surgeries are really the same, but the technology, really now the greatest technology and advancement is navigation. Our ability to find and operate on different parts of the spine without using big, wide open incisions. We can do things through much smaller incisions, smaller blood loss, and shorter recovery times.
So how have your patients responded to that?
Very well, very well. I think most patients nowadays can go home the same day after a spine procedure, as opposed to what it used to be like.
Wow, exciting. Okay, well, thank you so much for what you're doing. Tell people where they can get in touch with you.
My office is located at Greater Baltimore Medical Center in the Department of Neurosurgery.
All right, and we have all the information there right on our screen. Thank you so much, Dr. Rami, for being with us.
Thank you.
Appreciate you.
Thank you.
All right, stay with us.